ABC, the ABCs of Advanced Care Planning. My name is Laurel Gillespie. I'm the CEO of the Canadian Hospice Palliative Care Association and former Director of Advanced Care Planning in Canada. So I'm going to be your moderator today for today's webinar. So I'd like to begin this meeting by acknowledging respectfully that the Canadian Hospice Palliative Care rests on the unceded territory of the Algonquin and Anishinaabe peoples. Just a couple of housekeeping items before we begin is that everyone has been muted upon entry, and we would ask if you could put your questions in the chat or use the raise your hand function. Recording will be posted of today's webinar on the Advanced Care Planning website, and an email will be sent to all those who registered with the details on how to access it. Subject of today's webinar stems from a recent national poll commissioned by the Advanced Care Planning Project around Canadians' attitudes towards advanced care planning and end-of-life care. And the results were compared against those from the poll that was done at the initial stages of this particular ACP project, and that was done in 2019. So one of the key results tells us that while 59% of Canadians are talking to family about their healthcare wishes versus 36% in 2019, there are still barriers and misconceptions preventing them from taking the next steps. So you may have seen a link for more information about the poll in your registration email, but if not, Michael can post it in the chat room so you can access it. I think it's worth noting that the work that we do in Advanced Care Planning Canada stems from the document Advanced Care Planning in Canada, a Pan-Canadian framework, which really essentially provides a snapshot or a roadmap, if you will, for ACP in Canada, where we've been and where we want to go. And Michael will also include a link to that in the chat room. So for today, what we're going to be covering, this is what the Pan-Canadian framework looks like. It's a beautifully done document, and it's available on the website to download in French and English. So what we're going to cover in today's webinar includes an introduction to advanced care planning. What is it and why do we do it? Why should we do it? And how do we start? I think that's probably often the biggest hurdle, is just actually starting it and really thinking about the process. Why you should involve your physician in the process of doing it, and as well perceptions and myths around advanced care planning, what it is and what it isn't, and what it can do for you and what it's not going to do for you. We'll also set aside some time today for your questions after the various presentations. But before we hear from our speakers today, we're going to start out with a quick little poll asking if you have ever talked to about your healthcare wishes with your family or friends. Wow. Okay, so obviously, if we were conducting a poll with you folks, fine folks today, we'd have great success. And unfortunately, we're in the know, and the average Canadian, we're getting there. We're making some small strides, but we're not nearly where we are in terms of engagement. And that's one of our continuing and ongoing challenges and goals and objectives. So I'd like to I'd like to introduce our guest speakers. So we have joining us today, Lauren Thomas. She's with Advanced Care She's an advanced care planning nurse clinician with Fraser Health and Authority in British Columbia. Dr. Yaning Go, physician of Brunswick Medical Center in Quebec. And Michael Makatiag, residential manager of the Milieu Family Services of British Columbia. So Lauren will begin by taking us through an introduction to advanced care planning. And I invite you, Lauren, to share your screen.
Awesome, thanks, Laurel. I'll just wait for all these things to load and unload, reload. So thank you for having me here today. Again, my name's Lauren Thomas. I'm a nurse in Fraser Health Authority in British Columbia, in Lower Mainland. And ACP Canada asked me to come and talk about what is advanced care planning. And Lauren, you have 10 minutes, which is actually a really welcome challenge. So, because I think when we talk about advanced care planning and we start going down this road of this topic, things very quickly get complicated. And sometimes us, especially as healthcare providers, myself as a nurse, what we do is we take simple things and we complicate them. And so we make these things more difficult than they need to be often. So hopefully I can lay a bit of a foundation here in 10 minutes about what is advanced care planning, how to start, and then our next speakers can build upon these concepts. So what is advanced care planning? The running joke on my team in Fraser Health is, what is advanced care planning? It's planning in advance for your care. And I know that seems really silly, and every teacher under the sun would punish me for using the word to describe the word, but that's exactly what it is. And so when we start thinking about planning ahead for our healthcare, we can do this comparison by looking at the other things that we plan for in our lives as adults. And this is the life planning model created by ACP in Canada, where it kind of shows you the comparison between these different types of plans that we make. I would even argue that it's not much different than planning a trip, planning a vacation. Oh, how I miss those now in COVID. But planning is planning. And so it's not unlike some of the other things that we do as adults. Planning for our finances, making plans for after we've left this earth. All of these plans are lifelong. They are definitely proactive, and they're often very reflective. All of these plans definitely change over time too, because when we look at finances, some of the things that I was saving for when I was 21 are not the same things that I've been saving for today. And so what is advanced care planning? It is this lifelong proactive reflective process. And all of these plans of our healthcare are focused around our values and beliefs. What is it that we want ahead for us in our health? We're going to be faced with a lot of different decisions. I don't know what's going to happen to my health as we move forward, but something will happen and I will be faced with a decision. And we know that making these decisions in a clutch, in a crisis, in the middle of the emergency room are really not ideal places to do that. And so if we can spend some time ahead of time, even as a healthy adult, to talk to family and friends about our expressed wishes, what's important to us, what brings our life meaning, purpose, and joy, thinking about a substitute decision maker, and maybe even as things get farther down the line, as we continue to face multiple health decisions, looking at medical orders and goals of care and different types of things like that. So we can only anticipate so much though when it comes to our health. Nobody here has a crystal ball. Again, I don't know what's going to happen to me and my health as I move forward. And so advanced care planning is definitely not about choosing treatments ahead of time. It's really about outlining those values and beliefs and equipping the people that are important to us with those values and beliefs so that they're better positioned to make good decisions for us if we ever can't speak for ourselves. And so why is this important? Again, it's just like any other plan. The choices that we make as adults shape who we are, and they shape where we want to go. And so sometimes we make decisions that actually are not going to achieve where we want to go. So we need to, again, take that time to create a plan and think about what might be ahead. Because I don't know about you, but if I've learned one thing during COVID, it is definitely that life is unpredictable. Planning really helps give you that control over what happens to you in the future. It really gives you a say in if there was a moment that you wouldn't be able to speak for yourself. If you don't make plans, there are laws in place across Canada that may decide for you anyway. And we're briefly going to touch on that a little bit as we move forward. I'm going to provide some resources for you to learn about the decisions in the laws in your area. And really putting plans in place really eases that burden on your loved ones. And I think we see in a lot of marketing and different things around advanced care planning, it's sort of posed as this gift, right? It's this gift that we can give our loved ones. As a nurse, I've been at the bedside and I've asked family members to say, well, what would your mom have wanted in this situation? And I've often heard, I don't know, we never talked about it. And so really it's a way to give yourself a voice, and it really is a gift to family and friends. And so just like any other good plans, they shape good decisions. And what I mean by good decisions is good decisions for you in your context, not necessarily what anyone else thinks is a good decision. So the bigger question, and I think where the complexity comes into place, is the how. How do we do advanced care planning? Advanced care planning in Canada has really given us these great 5 steps to really get that process going for ourselves and for others. And it's these 5 steps that are listed here: think, learn, decide, talk, and record. So really, I know they say 5 steps, and I've listed them in a long list here, so I've made them look linear, but really they're not. You can dive into these steps wherever you feel comfortable. Some people start at the bottom and go backwards. Some people start somewhere in the middle. It's really up to you about where you're comfortable starting with first. But in the 5 steps, when we say think, what are we thinking about? So the think part is that reflection process. This is where we need to sort of take some time, stop the craziness of our lives, take a breath, and think about what's important to me, what matters to me most, what brings my life meaning, purpose, and joy. And when I think about those things, I know some people start to blush or feel a little bit silly because they say, you know what, the most important thing in my life is my dog. Or one of the things that really brings me joy is hopping on a paddleboard and going down to the beach and going for a paddle. These are not silly things at all. How we choose to spend our time, who we choose to spend our time with, what we do, our hobbies, the meals we make, all of these things are a reflection of our personal core values. And our personal core values and our beliefs are what we use every single day to make decisions. And when we make decisions about our healthcare, it's no different. We continue to make decisions surrounded by our personal values. So really narrowing down what those things are for you and what they mean for you in your daily life is really important to think about those things first. Secondly, the second step here is learn. What we're asking you to learn about is your health. It's really hard to make decisions about, whether or not you want to try this new blood pressure pill if you don't know that you have high blood pressure and you're not really sure what that entails. So really understanding what is going on with your body, having good conversations with your physician to making sure that you understand what hypertension is and what that may mean for you down the road. What can you expect? And how are we going to work together to control this? Because really, again, knowledge is power. And when we understand our health and our medical circumstances, it better equips us to make decisions should they come along. Step 3, decide. So what are we deciding here? Like I mentioned earlier, we're actually not deciding on any treatments ahead of time unless you're faced with a decision right now. What we can decide on ahead of time is who would speak for me if I can't speak for myself. And across Canada, we call that a substitute decision maker. Substitute decision makers have different titles in different provinces. We'll touch on that in just a moment. But really thinking about, what are the qualities that I would want in a person who would speak for me? And when we think about those qualities, often different adjectives pop up like advocate or clear communicator or, somebody who knows me well. And so when you put all those adjectives together, we often start to think about an important person in our lives, whether that's a family member, a friend, a neighbor. It doesn't matter, but there's some steps that we can go through to make sure that your choice of substitute decision maker is honored in your province. So really thinking about who would be that voice for you if you couldn't speak for yourself. Fourth, talk. All of this reflection and learning and deciding is all super, super lovely, but if you keep it all to yourself, it's of no use. And so really talking to, especially that substitute decision maker, but also all those other important people in your life that usually surround that substitute decision maker and provide a supportive network. So for me personally, my substitute decision maker is my husband. But I made a point of sharing all of my values and beliefs with my mom and my dad and my best friend and my sister-in-law. Because if my husband has to make a decision, I want my whole support network to gather around him and say, you know what, Colin, you're doing the right thing. This is what Lauren talked about. So really keeping these conversations going over time, because sometimes our values change, sometimes our substitute decision makers change, our health changes. So these conversations really are never ending. Step 5, record. And that means record in the truest sense is get all this information down however you see fit. For some people, that's a written document. For other people, it's a video, it's a poem, it's a letter, it's an audio recording. However you want to get some of this down. If there's legalities involved, then legal paperwork might be a great piece to add to your plan as well. So in a nutshell, that's how we do advanced care planning. Now I've mentioned it already, but there are differences across our provinces when it really comes to substitute decision maker across Canada and consent laws on who can give consent. Our laws are not national. And so each province forged ahead and they made their own consent laws and they used a different language. Super convenient, right? Not really. So really, really important that we educate ourselves on the differences in each province. And so when we think about those 5 steps, in step 2, I told you to learn about your health. I would even argue that there's a second thing that you really need to learn about, which is the substitute decision maker laws in your province. Many of us now have family members that live all across Canada. And so when I say representation agreement to my friend in Ontario who says power of attorney for health, we're talking about the same things, but there's different language, and it's really important that we identify that because they mean different things in different areas. I hope I'm not anywhere over my 10 minutes. To be honest, Michael and Laurel, I'm not even looking at the clock. But just to wrap it up there, I hope that provides just a quick little foundation about what advanced care planning is and how to start. You know, and really these conversations, again, I cannot stress enough how much they are never ending. I think often we enter into healthcare situations where we go, you know what, my husband knows me. But I gotta tell you, last week, my husband handed me a cup of black coffee and I've never drank black coffee in my life. So we need to ask, we need to tell, talk, share, chat, and connect with those who matter most. I'm just gonna open the chat box here. And Michael, are you able to put in the link to the ACP Across Canada page? I really think that's helpful for people in the chat box there.
Absolutely.
ACP Canada website, yeah, has a lovely interactive map of Canada where you can click on the province and it gives you the provincial specific information. There's tons of resources out there, but I personally really love that one. So thank you so much for doing that, Michael. I really appreciate it.
Thank you so much, Lauren, for that presentation on advanced care planning. And I know our time is a bit tight today and you were perfect in your timing. But I recently just lost my mother-in-law we're up in the Wakefield area of Quebec, and the local hospice was shut down on June 20th because there was no nurses to work in said hospice. And she passed in the hospital, and we were very fortunate to both be at her bedside during COVID. And the nurses were just phenomenal, despite the fact that it wasn't where I had thought she was going to be able to pass away. But we went through that process with her, and she was a tough nut to crack in terms of having that conversation. She lived with us here for just about a year, and it took a good 9 months, but we kept prompting and saying, hey, have you thought about, I've got my DNR, I don't need anything else. So you have to find it. It's different with everybody when you start to have these conversations, but eventually you can get something out of them. So I said, well, what about dialysis, for instance? Would you want to have dialysis, and for how long? And that was at that point prompting these discussions, because it's so much more than just a do not resuscitate order, for those who don't work within the healthcare field. But what a difference it made. I lost both of my parents, youngest of 8 kids. Neither one of them, we didn't have a clue, other than to know that they didn't want to be cremated. Well, that wasn't very helpful during the dying process, or respectful of their wishes, but it was complete night and day. And it's so important for everyone to engage in, and it really truly is the best gift that you could give your loved ones, and those you care most about. So thank you, Lauren. That was a great presentation. I loved your slide deck backgrounds. They're really, really well done. Thank you. So the 2021 national poll told us that while more Canadians are talking to their close friends and loved ones, lawyers and financial advisors about their care wishes, very few, in fact, was 7%, are actually talking to their healthcare providers. So Dr. Ningo is a physician at Brunswick Medical Center in Quebec and the Montreal Chinese Hospital, and an ACP champion. And I'd like to ask her to begin her presentation, and she'll be talking about the importance of involving your physicians as part of these talks and asking those questions that we don't have the answers to. And I do hope I pronounced your name appropriately. I came in late, so I didn't have a chance to ask you. So my apologies in advance if I didn't pronounce it properly.
It's okay. It's Yaning. Yeah.
Yaning. Okay, thank you.
So I'm happy to be here. I'll introduce myself. I'm a family doctor in Montreal, and I do comprehensive office-based work. And I work at the Chinese hospital. The Montreal Chinese Hospital is actually the first ever Chinese hospital in North America. It was actually founded in 1918, 100 years ago. Due to the Spanish flu pandemic, it was founded by Catholic nuns. And afterward, it became like a hospital for Chinese patients. So a lot of my patients and their forebears were actually, they built a railroad in Canada. So they've contributed a lot to the Canadian society. And I'm very, very proud to serve my own community. And these patients who have dementia, they are very vulnerable. And often they live in isolated community. And usually my patients are unilingual or speak only Cantonese or some English. So the hospital is actually staffed with nurses who speak Cantonese. And for the past 6 or 7 years, I've been serving this community. That's why I come to know about advanced care planning. And I actually wrote a article related to grief during the pandemic. And I was quoted on social media by the Advanced Care Planning website. And that's how I got to know the website. And I said, I actually have a lot to say about advanced care planning. And then I wrote an article about it, focusing on the care here that we receive in Quebec. I find the poll 8%, 7 or 8% of people talk to their physicians. That's fairly low. And physicians are actually really well versed, and they're able to answer questions about medical condition. I have a female friend who's also a doctor. Her parents went to see the notary recently because they've had a new member to the family, a grandson, and they did their will and living will. And at the end, her father told the notary, he said, I really want to make sure that I don't receive unnecessary surgery at the end of my life. And the notary actually said, oh, then we should add that line. And when he came back home, my colleague said, well, you know, like no doctors will give you unnecessary surgery. That's not what we do at the end of our life, at the end of life care. I think he meant that he didn't want any heroic measures, and that's his value. You know, so the notary would not be able to answer questions related to forced or artificial feeding, forced or artificial hydration, dialysis, cardiopulmonary resuscitation, and what it implies to patients. And for sure, family doctors or just physicians could support patient and patient family members, and they can document patients' wishes and even start the advanced care planning or even do a living will for patients in Quebec. And for sure, I think the role of family physicians would be also to advocate and educate patients, and that's something I enjoy doing. And I feel for my patients who were grieving. A lot of my patients, they lost relatives during COVID. And I understand there are some barriers for patients to discuss advanced care planning with their physician. First of all, even in the academic circle, there are a lot of physicians, family physicians, who believe that advanced care planning shouldn't be a family physician's role because family physicians are busy enough. Family physicians do this, that, and that. I don't believe so. I understand that we want to involve specialists, we want to involve nurses, NPs, physiotherapists, but I still think it is a physician's role. It should be actively promoted. It should be included in patients' treatment plan. I know that Lauren, she works with congestive heart failure patients. And actually, since 2017, the congestive heart failure guideline do recommend specialists, cardiologists, to talk about advanced care planning with their patients because after the first hospitalization for CHF patients, the mortality is high. So specialists should be prompted to talk about these issues. And for sure, patients have told me that they've had concerns about advanced care planning because they worry about, you know, will the doctor still treat me if I have these plans? Is my disease that bad? Is that why the doctor wants me to think about my affairs? You know, people have these misconceptions. Or patients ask me, like, do I have enough understanding about my disease? Is something really wrong? A lot of patient education should be done in this area. Another thing I want to talk about is the advantages of having advanced care planning in the long-term care setting. So having discussions about end-of-life care reduces actually the likelihood of conflicts between family members. I have patients who don't have people to advocate for them, to make decisions for them. So sometimes a public curator is involved, or maybe their relatives don't have the best interests for them, or they don't have the advanced care planning, and the children are actually, they cannot decide on the best care for the patients. So there are consequences of not having advanced care planning is that, you know, we might involve a public curator in this case, which is something to think about because, you know, would you like someone who's not in your family to make decisions for you? And another questions that I get is that how should I talk to my doctor about advanced care planning? What kind of questions should I ask? How do I educate myself? So for sure, the ACP website is a good place to start. But questions that I want patients to think about would be, you know, what is considered heroic measure for my condition, for my situation? What are the benefit and risk of medical procedures or treatment that's in the living will, in the advanced care planning plans? What is palliative care? What is do not resuscitate, DNR, what is palliative sedation, what medications is given to patients, and what do they do, and what happens when somebody dies, how do they and how do they react, how do people die, and so these questions I do encourage patients to ask. I don't think it's only when patients starts to have cognitive impairment or patients start to have a chronic disease that we should think about it. So that's my, and another take-home message that I have is that I think having advanced care planning reduces stress and anxiety and depression for the surviving relatives. So it actually help relatives to grieve. So that's something that I advocate. So that's it for my talk.
That was amazing. I'd love to have a chat sometime or have a coffee over Zoom and talk about like what you find some of the barriers are to those discussions and in the context of culturally and that kind of thing. Because I'd imagine it's a bit different with such a focused community base that you're working with. So it's interesting, really, really interesting. So thank you for that, Yang Ning.
We have a question in the chat. Blaine is asking, at what age should advanced care planning begin?
So there are some people who advocate that, when you go get your will, then you should also do your living will. But the living will is something that's very medicalized. It only, in Quebec, it only talks about, the 5 medical procedures, whether you want it or not, at the end of your life. It doesn't really address patient's value, as Lauren said. So the conversations, if patients have close ones or relatives, really it's a series of conversation with your substitute decision maker, your close ones, and also with your family physician. Your family physician can advocate for you if ever you have diseases, because as family doctors, when we take on patients, patients might not have any diseases. Patients might be totally healthy, but down the line, female patients can have children, people get older, I have patients who, might be 60 when I take them out. Now they're in their, late 60s and things might develop. So and physicians can advocate for patients and help patients understand their condition. So should there be a specific age for advanced care planning? I would say, everybody should think about it, around age 50, if I can say it right. And if someone, the poll says there's only 8% of people who talk about it with their physician, and that's for adult patients. So I do encourage the conversations with relatives and the physicians. Does that?
If I could just add to that too, out here in BC, we really do promote that advanced care planning really should, at the very least, begin at the age of consent. So in our province, that's 19. So this is definitely something for all healthy adults to take part in. We see 19-year-olds in the ICU all the time who have had a skiing accident or something like that. And once you reach the age of consent, you are able to make your own health care decisions. Mm-hmm. We've even found that when we do talks in the public, we've done lots of talks to retired teachers, actually. We see a lot of retired teachers, and they say, why aren't we talking to mature minors about this? I mean, advanced care planning really should be added to that package of how to be an adult. Adulting 101, here's how you manage your money, here's how you choose a career and be out in the world. And if I've learned anything about being married to a secondary school teacher, it's that adolescence is all about discovering who am I, what are my values, what are my beliefs. And so as kids start to build that, it really helps prepare them for young adulthood. And so we don't really put an age on it, but it's for everyone.
For sure.
We have another question from Blaine. He's asked, should the physician be the best person to discuss these topics normally, and particularly if there is resistance? Yeah, Neen, can you?
Yeah, that's why there's so much debate in the academic circle whether we should be addressing this. But I do think so. I do think, there's no way around it. If you're a hospitalist, as Lauren said, if patients are hospitalized, they are obligated to have a level of care, So when patients develop chronic diseases that are severe, that we know the path of the disease, I think physicians do have a duty to discuss this. Part of our role is patient education. Patients need to understand that, there's importance to plan for the end of life care, to think about it at least.
I'm going to just build on that a little bit. I have 3 adult children, and I think that it's not unreasonable to expect that once one has the ability to make decisions about organ donation, as example, when they get their driver's license, and they reach that age of majority, respective of which province they're residing in, the younger, the better to engage in this. It has to become part of a natural life process. It's part of a healthy living. It's like as much care as you put into, preparing to get a puppy, as an example, or buying a home, or doing something that's going to significantly change your life. These are all times when you should be automatically thinking about, how is this going to impact my advanced care plan? Even when you're healthy, is ideally the time that anyone at any age, it's never too early. Even children, sometimes in pediatrics, you hear talk of what's important to children who are nearing end of life. So it's never too early, but it can be sometimes too late to begin these conversations, especially when there's cognitive impairments and the like. And not everyone has the patient's best interests at heart when it comes to family. So, it's a way of protecting yourself, but it's also a way of ensuring and taking some ownership and autonomy over ensuring that your values and wishes and beliefs and desires are reflective of your circumstances and honored. Do we have another question here, Michael? So someone's saying that not everyone dies of old age, so we need to discuss it early. So there's another question here about, if you request a DNR and no heroic measures, does that eliminate the possibility of being an organ donor or tissue donor? And if so, do you have any suggestions for wording in a living will to express your desire that you be kept alive long enough to reach an ICU and be assessed as a potential donor, even if there is no hope of your own survival? It's in the chat if you'd like to reread that, Dr. Moon.
I don't really know the details about the laws about retaining
tissue donation, and
the ethics about it, but I think if it's expressed with your substitute decision maker, it can be an option to be considered in major tertiary hospitals,
Here in British Columbia, a DNR order does not leave you out of still being able to be an organ donor. So you can have a DNR and still donate your organs. Those two are not mutually exclusive.
Thank you, Lauren. So moving on to the third presentation piece and following up with the poll. The poll told us that many Canadians don't engage for various reasons, including a lack of relevance. They feel that it's morbid or even depressing, and they're not being encouraged by the people close to them, and they don't really have the time. So Michael MacTieg is residential manager of Milieu Family Services in British Columbia. And he has a very personal story around advanced care planning and dispels some of his own initial perceptions. So welcome to you, Michael.
Hello, everyone. I'm glad to be here. Thank you for having me. Yeah, I work with Milieu Family Services as a residential manager. And my role is to be actually the advocate of the individuals that we support. And when we were doing ACP in our agency, I was mainly supporting family members and the individuals themselves in filling up the documents regarding the My Voice documents of ACP. Now, the things that I encountered during those times were that you mentioned that, okay, why, Michael, why are we talking about this? It's not relevant to me. I'm healthy. My family members are healthy, and it's not the right time for us to be talking about it. And that's actually number two. It has become a sensitive topic because they have thought that it's already associated with death and dying. And number three, because of that, it has become a non-priority for them. We're just not gonna talk about it. And again, the family members were not encouraged to actually participate in it, and that's why the individuals we support were not encouraged to engage with it. So as we were filling up the My Voice ACP, the things that I have learned about it is that, number one, ACP ensures your wishes, beliefs are followed and respected, right? As an advocate, as the person who is the voice of an individual who actually is nonverbal, my role is to make sure that his voice is heard. And the way for us to be able to do that is to fill up an ACP form for him or for her. And so once we have done this for them, we're going to submit it to the ACP. Now, as an advocate, my role is to think of all the things that is important for this person. What is really important for you? What are your goals? I mean, what do you want to happen when you are unable to decide for yourself? And that's what I'm going to write on that form in order to be submitted to the healthcare providers. Now, it is not My Voice. When you actually go through it, it is not complicated. You can actually do this in one sitting, but of course, I don't really recommend you do that. You sit with the relevant people in your life. You do it with family. You have that discussion with your doctor as well. You have the discussion with friends, people who know you, and for the people that we serve, they have talked to their staff and me as their manager. So that's what we have done for them. And again, as I have that meeting with family, with the individuals themselves, we have come to think that, oh, okay, because we have already put all of their wishes in this ACP, that it actually reduces the burden to anyone, right? When an event happens, all we need to do is just to follow what's written there. And that actually reduces a lot of anxiety. It actually reduces confusion and actually eliminates assumptions, which would make the person really happy because we're actually respecting what they have told us. We're actually following their instructions. And so it was also mentioned a while ago that, when should we start doing ACP? Yeah, I do really agree that as early as possible that we have these conversations. Start early before an event or a health event happens. And because we are now at a moment wherein we can actually think and reflect on what's important to us, what I want to happen before the health event, is that the things that we write on the ACP is more accurate, more personal, and more meaningful. So being an advocate for your family, you become their voice. That's what matters to us. Being an advocate for the people that we serve, that we support, we become their voice. And this adds, light and a personal layer to the person, right? It's not just about medical. It adds a bit of humanity to it, you know, in terms of just an example. We support someone who's actually nonverbal. So this person could not readily express themselves about what they want to do or to put in their ACP. I mean, to happen when an event happens in their life. Now, as support workers, we know that this person can communicate via ASL, which is sign language. Now we put that in the ACP so that when an event happens, the health providers can see that, oh, okay, this person needs someone who can communicate via ASL. Now, some of the values that they have written in the ACP also is personal. So, for example, when they ask them, "Oh, okay, can you tell us what's really important to you when you are unable to communicate what you want during the time when you are hospitalized?" And they would say things that are really important for them, like their routines. You know, I still want to be able to have my coffee every day. So those are the things that we put for them. And to that person, that's really important. You know, it's something that's high up there, that is something that they cannot live without. I still want to have my coffee. So when a health provider or a doctor sees that, okay, maybe we can look into some medications that will not react to caffeine or to coffee or something like that. So now the treatment becomes personal as well, more tailor fit. So, and that's how I was able to mention that it can actually help with the healthcare system as well, because now the treatment that you're receiving is more personal, more tailored to you. So that's our experiences during the time that we were doing ACP for our clients.
And it's so refreshing to hear that approach, Michael. And it's unfortunate that in Canada, we don't have sort of a National Disabilities Act. And often those who are already marginalized within our communities are further marginalized when it comes to service delivery. And I think people genuinely do the best that we can, but we don't have a lot of guidelines or best practices. So you're setting the bar high by ensuring that those with various disabilities have an opportunity to have their voices heard and have those accommodations made to ensure that they're well documented and then respected. So kudos to you for that great work and looking at it through the lens of those who aren't able to always speak up for themselves. So I really appreciate that. Does anyone have any questions for Michael? I know some of you have been asking in the chat room, so we're caught up, but I'll invite you to ask away, or we'll go back to our slide presentation. Okay. I don't see any microphones going off, so or anything coming into the chat room. So we'll come back here and share. We're going to just, after following up with this, is do a quick poll. Now that you know a little bit more about advanced care planning, we'd like you to answer another poll question. How comfortable you are with starting an advanced care plan? Michael, I'll invite you to share those results when they come in. There you go, somewhat comfortable. It's a process. It's a process. And for some people, they're very comfortable having the discussion. But it's a process, and it's an ever evolving activity that should become a normal part of your day-to-day healthy living. So there are a couple questions here. Someone's asking, has anyone ever heard of the Hello game? Now, this came in from Donna Gustafson, and the Hello game, from my understanding, it was done through the BC Center for Palliative Care, if I'm not mistaken. I could be mistaken, but I'm pretty sure that's where it came from. It's an interactive game that you can play with your family, or loved ones, or anyone who's in your circle of trust, to really talk about and engage or start those conversations. Similarly, we've done in the last couple of years, we also do something similar with advanced care planning for Advanced Care Planning Day, and encourage people, much like on Earth Day, we dim our lights or turn our lights out to signify that we're cognizant of the environment and climate change. So from 6 to 8 p.m., wherever you are in Canada, we encourage people to take that day, Advanced Care Planning Day, April 16th, each and every year, to begin the dialogue or discuss with your family or play a game similar to the Hello game to start that dialogue. And there's another question for Michael from the Milieu Center. Is something or anything being done in Ontario? Michael, I'll invite you to answer that question if you are familiar with anything that's happening in Ontario.
For Milieu, currently we are located at British Columbia, so I wouldn't have any idea regarding that. Yeah, sorry about that.
I've had the distinct pleasure of working on and off with Bob Park. He's a bioethicist out of Toronto. And there is a document on our advanced care planning website that he was part of a team that cultivated it in addressing advanced care planning with those who have intellectual disabilities and how to broach those subjects and the importance of it. So there's some good resources on our website, which Michael will put, I'll get you to put, our Michael Powell, I'll get you to put in the chat room so people can have access to it. And as we wrap up today, I'd like to thank everyone for attending today's webinar and hope that you found it useful and valuable. And if you wanted any more information about advanced care planning, you can visit our website, which is www.advancedcareplanning.ca. There's no D at the end of advance, it's advance, not duh. So that sometimes people have trouble with getting the website address correct. And I'd like to take the opportunity to extend the invitation to register for the upcoming webinar on September 1st that speaks to the legal implications of advanced care planning, because the laws are different across the country, coast to coast to coast. It would be nice one day if we had some structure on sort of a national approach to it, but one step at a time. But most importantly, embrace your loved ones. Stay healthy, stay safe, try to get through the forest fires out in BC and everywhere else in the country that we're having extraordinary events happening with our weather and heat. But embrace your loved ones and those closest to you and start the conversation, because it's never too early. Michael just put the registration link for the next upcoming legal implications a webinar on September 1st. So thank you to our speakers today, your presentations, and for all of those joining us today for taking the time to learn more about advanced care planning.